Hello, and thank you for stopping by the Chesapeake Medical Imaging Congratulatory Podcast with Dr. Kevin Berger, as he was the recipient of the What's Up Magazine Top Docs winner for October 2023. Congratulations, Dr. Berger.
Thank you very much.
Yeah, and in looking into this award, there's different awards that are out there for top doctors, and I think what makes this one really special is it's professionals nominating professionals, and there's a nomination process, there's a finalist, and then there's a voting process. And to truly be viewed by your peers as a top doc has to be rewarding. Can you comment on that a little bit?
Thank you. Yes, it is rewarding. Radiologists often are kind of the doctor's doctor. We often are the one that physicians consult for opinions to help take care of their patients. So that kind of means that they value your opinion and your interaction, and that is deeply rewarding.
Yeah, and I can certainly attest that you are a top doc from a marketing perspective, as you are out and about and on the phones daily building those relationships. And we can't thank you enough for everything that you do for CMI. And it's good to get you out of the reading room a little bit, and let's get to know you a little bit. So, Dr. Berger, where were you born and raised, and where did you do your schooling, and what brought you to CMI?
So I was born in Livonia, Michigan, and I attended the University of Michigan for both my undergraduate and medical school. And then I did my diagnostic radiology at Mallinckrodt Institute of Radiology, which is part of the Washington University system in St. Louis. And I did my diagnostic radiology and neuroradiology fellowship there. And then I was a professor of radiology, assistant professor of radiology at Michigan State University for 10 years. And then I've been at Chesapeake Medical Imaging for 12 years.
So it sounds like you have a little bit of an academic flavor, and then certainly here at CMI, we're kind of in the private sector of the outpatient industry. Kind of compare and contrast some of the differences and what appeals to you to be here at CMI.
So Dr. Begans has a personalized vision of patient care. And we're kind of unusual in a radiology practice that often is reaching out to our patients and our physicians and helping direct and guide their care in a way that you don't see sometimes in larger and impersonal institutions. And so that opportunity to really impact patients and patient care is very rewarding experience, and a little bit more unique among type of radiology practices that you see in the country.
Dr. Berger, I can certainly attest to the community feel that Dr. Begans brings and truly taking care of the patient. And that certainly does set CMI apart from a lot of the other radiology entities in the state of Maryland. Dr. Berger, I know radiology is constantly changing, right? And artificial intelligence is more popular than ever. And I know from a radiologist perspective, years ago, some viewed AI as a threat. You've really taken it a different approach in that you welcome AI, you embrace AI, you go out of your way to encourage physicians to refer to CMI based on your specific approach to AI. Can you comment a little bit about on that?
Yes, I mean, honestly, I've spent, 25, 30 years in developing software programs that help analyze image data. And when you do that, you actually start to embrace what computers do well. And as somebody has really helped develop some of the tools that we use that have finally become in commercial development, it's very exciting to me. So I embrace artificial intelligence because I know what it does well, and I also don't feel threatened by it. And radiologists, I think, are increasingly embracing AI tools to provide more objectivity in diagnosis, provide more quantitative measures of changes in patient anatomy, as well as function, as well as over course of time, that improves our ability to discern what is going on with different patient states. And so I think it's becoming more and more popular and will become more and more integrated and necessary in patient care if we really want to optimize patient care experience.
Yeah, Dr. Berger, I like how you say embrace it. And I know when you go out into the referring offices, into the field and talk to providers, it's you position it as not a threat. And I remember you saying, the computer matched with your experience and eyes. It's a win-win. It's a kind of a no-brainer to embrace it as opposed to kind of push it away.
I agree. I embrace artificial intelligence because I've seen how it's helped me.
Mhm.
And that's the first message I usually give to referring physicians is that this helps me take care of your patient. So it tells me, does this patient look more like a patient with Alzheimer's disease, or does it look more like a normal patient? And it can search hundreds and hundreds of different patient databases and take this individual patient and compare them in a statistical fashion, where I can only compare them in a qualitative fashion. And that adds objectivity and weight to making differential diagnoses more accurate. And they appreciate that. And when they hear it from me, who's had 25 years of reading images, tell them that I welcome it and I embrace it because it helps me, then they realize, well, it's not a threat. He's not threatened. He's using it as a tool that helps him. And I think then they recognize that that's a tool that can help them too.
Oh yeah. Oh yeah. And Dr. Berger, I know you just mentioned, radiologists experience 25 years. You've been on the forefront of some of these AI platforms and helping develop those. If you had a crystal ball, right, where do you think kind of radiology's headed in the next 5, 10 years? What do you foresee?
I definitely see that it's actually growing. It's already been aiding us in making differential diagnoses. It's aiding us in making probabilistic statements about what type of disease the patient has. It's helping us. So, for example, in multiple sclerosis, we can actually now quantitatively track their disease burden and show over time how it's changing as a percentage or a volume. It can identify for us what are new lesions, what are increasing lesions, so that aids the objectivity of our diagnosis and assists our diagnosis, and well as quantitates patient care change. In the world of dementia, which is becoming increasingly more relevant right now because of this interest in treating patients with Alzheimer's disease with new classes of drugs that can affect beta amyloid deposition in the brain, it now is, well, incumbent on patients to know, well, what is my disease burden? Am I someone that should be diagnosed with Alzheimer's disease? Would I benefit from a treatment? And now we can actually offer statistical answers to those questions. This is how much amyloid plaque has accumulated in the brain. And that can help them influence whether they're going to potentially go on that type of therapy. And even before that status, patients want to know, do I have dementia, or does my loved one have dementia? Is there a more objective way than just a personal interview or some questions? And we do. We can actually look at brain function. We can look at FDG brain PET images and see what areas of the brain are not really responding normally and have decreased uptake. And we can predict what type of dementia they have using an analysis of that data, often aided by quantitative tools. And we've actually moved that recently into the realm of MRI, where we do volumetric imaging, and we can look at various regions in the brain. And we can actually offer probabilistic statements of this brain corresponds to with this loss in the hippocampus corresponds to an 80% probability they have Alzheimer's disease. It is that similar. So I think it's assisting in diagnosis, it's assisting in objective diagnosis, it's assisting in quantification, and it's assisting now in guiding patients to the appropriate therapy, which is exciting because that's a new change. These are new events happening. And new events, new drugs kind of drive new interest in making more accurate diagnoses.
And I know, Dr. Berger, I can speak firsthand that the quantitative analysis, the new interest, the kind of the evolution of a lot of these platforms. I know you're on the forefront of it, and you keep CMI ahead of our competition. And CMI is positioned better than ever. From a PET CT standpoint, we have 5 different locations. We added some new equipment at our Glen Burnie location. We have 14 MRI machines across our footprint. And I can't thank you enough for everything that you do for CMI and the patients and the referring community at large. So on behalf of all of us at CMI, we really want to congratulate you on being viewed, what we already knew, as a top doc, but with the What's Up Magazine Top Doc Award for October 2023. Congratulations again.
Thank you.